Hi, I'm Lindsay. I'm a Cedar Crest College nursing student, and this is my Research 2 presentation. My topic of interest is the effect of brace treatment in combination with surgical intervention compared to observation alone in patients with scoliosis. I chose it because I'm interested in the topic, and I actually have scoliosis myself, so I was interested in researching some treatment options and the effectiveness of one treatment option over another. The significance to nursing is that scoliosis is the most common spinal deformity among children and adolescents, and we as nurses do provide a lot of one-on-one care and direct care for these patients. The pain associated with scoliosis is often underestimated and hinders the quality of life. So the treatment goals are to increase the quality of life and to decrease the pain associated with scoliosis. So my clinical question, as highlighted in my poster, is in patients diagnosed with scoliosis, does brace treatment in combination with surgical intervention compared to observation alone improve patient outcomes? The process that I used for my literature search included WorldCat using the Cedar Crest LibGuides. I ended up having to broaden my PICO question in order to find results relevant to the entirety of the question versus only one part of it. So some key words that I did end up using were scoliosis, scoliosis treatment, and scoliosis surgery. I ended up choosing the three most relevant studies, which are highlighted in my evidence summary in the middle of my poster here, which I will introduce to you now. So the first study was Mariconda et al. From 2016. This study was used to evaluate the quality of life, functionality, and body image of subjects who had undergone surgery 5 to 12 years previously, and to identify outcome predictors for their quality of life. The design was a cohort study with 87 patients as a sample size, down from the 91 original patients who had participated in the study and hadn't finished for various reasons. The results of the Mariconda study stated that these patients who had undergone the surgery 5 to 12 years previously performed better than before their surgery, and they had a self-reported increased quality of life post-surgical intervention. So the second study that I used for my evidence table here is Shaw from 2015. Its purpose was to focus on the evidence-based practice for non-operative treatment options for scoliosis, such as school screenings, bracing, and observation alone. The design was a review of research, and the sample size varied depending on which study was being reviewed. It was consisting of patients with idiopathic adolescent scoliosis, and the results of the study ended up stating that bracing is a firmly established means of treating scoliosis in order to try to reduce the progression of the disease and to avoid surgery if at all possible. My third study in my evidence table is Abbott et al. From 2015. The purpose of this study was to identify prospective studies reporting the impact of surgical intervention on health-related quality of life for patients with adult scoliosis at a 2-year follow-up. The design of this one was a systematic review with the sample size varying depending on which study was being identified at the time, but it did again include patients with adult scoliosis. So the results from the Abbott study in 2015 voided that it suggests that surgery does improve the health-related quality of life in patients with adult scoliosis at the 2-year follow-up. So all three of these studies that I have in my evidence table here are in favor of some kind of treatment, whether it be operative or non-operative, above observation alone. My recommendations for practice, as highlighted on the right side of my poster, are that outcomes and patient satisfaction would be increased with the correction of the shoulder height discrepancy that's associated with scoliosis because of the lateral curvature of the spine, and the correction of the spinal curvature would also increase patient outcomes and their body image as well. Further research does need to be done on the genetic component of scoliosis in order to broaden the horizons as far as treatment options available and possible prevention if we can maybe do more research on that. So more consistent results may be obtained with various sample sizes and various study methods. If we increase those sample sizes and study methods, we might get more accurate results. So, in conclusion, I do have that on my poster as well. Scoliosis is associated with a decreased level of functioning, an altered body image, and an impaired quality of life. The three studies were, I brought the three studies together, and the evidence does suggest that it's in favor of treatment over simple observation alone. The recommendations for practice include further research needing to be done and a better understanding of the genetic component of scoliosis. I have my references in the corner of my poster in case you're interested in looking at more, but I really enjoyed teaching you about scoliosis and the treatment options available, and I really thank you for watching.